And then, I know when we first started out, blood loss during mechanical thrombectomy was kind of a big issue, but the advent of FlowSaver kind of changed that. Can you talk to that?
Yeah, to me, with all the engineers at Inari to me are, really phenomenal.
Yeah.
I mean, it's some of the best that I've seen. I mean, the engineering that they put into this device is really, really phenomenal. The FlowTriever tracks like nothing I've ever seen before.
Right.
But of all the advancements, to me, the FlowSaver is the biggest
That's the
advancement.
biggest game changer. Yeah.
I mean, we used to go, before we had the FlowSaver, we would go to about 500 cc of blood loss unless the patient was anemic,
Yeah.
and we would stop.
Right.
It didn't really matter how the patient was doing, we would stop.
Yeah.
Now we rely on clinically meaningful endpoints. To me, are the pulmonary artery pressures better?
Right.
The patient was hemodynamically unstable or the vitals were off. Are they better?
Yeah.
How is the angiographic appearance better? So to me, that has been a complete game changer. And on average, I know we probably lose 50 cc's of blood right
Yeah.
now.
Yeah. I would say if that, and I think like you said, I think the advent of FlowSaver kind of allowed us to treat more effectively because now you can spend more time doing aspirations and actually removing all the thrombus when, before I remember, we have not a insignificant amount of Jehovah's Witness patients down in Miami. So, I remember we would just have to be super cautious, watch our blood loss, and you may actually not have a endpoint from a treatment modality, but you had to stop because of blood loss. And I feel like that's really helped us, but also the volume status I think is really important. Even not just the hemoglobin going back in, but these patients they need to be so euvolemic and their volume status is so tenuous that I think that also helps.
No, and I remember there was even a patient where patient still wasn't doing well. We already had basically stocked out maybe 750 cc's of blood because the patient wasn't doing well.
Mm-hmm.
At that point, we actually had to transfuse the patient more,
Right.
just so we could do more aspiration thrombectomy, and that just really is an issue
Exactly.
altogether.
Yeah, exactly.